The uterus is an organ in the pelvis. It's where a fetus develops and grows during pregnancy. Your uterus is a pear-shaped organ in the reproductive system of females. It's where a fertilized egg implants during pregnancy and where your baby develops until birth. It's also responsible for your menstrual cycle. Your uterus plays a key role in your reproductive health and function. The three main jobs of your uterus are: 1. Pregnancy. Your uterus stretches to grow your baby during pregnancy. It can also contract to help push your baby out of your vagina. 2. Fertility. Your uterus is where a fertilized egg implants during conception and where your baby grows. 3. Menstrual cycle. Your uterine lining is where blood and tissue come from during menstruation. A retroverted uterus is a common condition that describes how your uterus sits within your pelvis. A retroverted or tilted uterus is when your uterus is tilted backward toward your spine. It doesn't cause any serious health problems, but can cause discomfort during sex and painful menstruation. A retroverted uterus means your uterus is tilted or tipped backward, so it curves toward your spine instead of forward toward your abdomen. Your uterus is the organ where a baby grows during pregnancy. It's shaped like an upside-down pear and sits in your pelvis between your bladder and your rectum. Its exact position in your pelvis varies among people and can change, especially during pregnancy. A retroverted uterus is also called a tipped uterus or tilted uterus. You can be born with a retroverted uterus, or it can develop later in life. Some people never know they have a retroverted uterus because they don't have symptoms. In some cases, you will have symptoms that may require treatment by your healthcare provider. This condition rarely causes health complications and is not a cause for worry. A retroverted uterus is fairly common. Approximately 25% of people have a uterus that tilts backward at their cervix. An anteverted uterus means your uterus tilts forward at your cervix and points toward your abdomen. This is the more common position of the uterus. In this position, your uterus is on top of your bladder. In a retroverted uterus, your uterus is usually pressing against your rectum. Your fertility shouldn't be affected by a retroverted uterus. You can still get pregnant and have a normal pregnancy. If you're unable to get pregnant and have a tilted uterus, it's most likely caused by another condition of your uterus that affects fertility. Some of the conditions associated with a retroverted uterus that contribute to fertility issues are: 1. Endometriosis. 2. Uterine fibroids. 3. Pelvic inflammatory disease. Your pregnancy shouldn't be impacted by a tilted uterus in any way. There is also no correlation between a retroverted uterus and complications during labor and delivery. In fact, pregnancy will cause your uterus to change to an anteverted position sometime before the second trimester. Your uterus may return to its retroverted position after your baby is born. Some people don't experience any symptoms of a retroverted uterus. For those that do have symptoms, the most common are: 1. Pain during menstruation. 2. Pain during sexual intercourse, especially in certain positions. 3. Trouble using tampons during menstruation. 4th, urinary problems like urinary tract infections or urinary incontinence. Some people are born with a retroverted uterus. It's present at birth and not caused by any health conditions. In some cases, it happens later in life. Some reasons you can develop a tilted uterus are: 1. Scarring or adhesions. Scar-like tissues from prior pelvic surgeries, including cesarean deliveries. Pelvic inflammatory disease, PID, or other infections, can cause the tissues in your uterus to stick to other organs. This can pull your uterus backward. 2. Fibroids. Uterine fibroids or other growths on your uterus can change its shape and position. 3. Endometriosis. With this condition, tissues like your uterine lining form outside your uterus. These cells can attach to other organs in your pelvis and cause your uterus to become retroverted. Childbirth. Once you give birth, your pelvic floor muscles and ligaments are stretched and weaken, which can cause your uterus to tilt backward. 5. Menopause. People who are in menopause will have weakened pelvic muscles due to a decrease in the hormone estrogen. The ligaments that hold your uterus can't support it and cause it to tip backward. Can a retroverted uterus cause bowel problems? There's not enough research to directly connect bowel conditions like irritable bowel syndrome or chronic constipation to a retroverted uterus. However, uterine fibroids and endometriosis, common causes of retroverted uterus, have been connected to symptoms of IBS. Having a weak pelvic floor from childbirth or menopause has also been connected to fecal incontinence. If you're having trouble with your bowels, speak with your healthcare provider about your symptoms so they can determine the underlying cause. Does a retroverted uterus interfere with sex? Sometimes. One of the main symptoms of a retroverted uterus is painful intercourse. This is because your uterus is positioned differently in your body. Certain positions and deep thrusting may intensify your discomfort. Switching positions may make you feel more comfortable. Talk with your partner so that you can find a way to enjoy intercourse together. How is a retroverted uterus diagnosed? Your healthcare provider can tell if you have a retroverted uterus by doing a pelvic exam. During this exam, your healthcare provider can feel the location of your cervix and uterus to determine which way it tilts. Sometimes an ultrasound is used to confirm a retroverted uterus and rule out more serious causes like uterine fibroids or endometriosis. Are there any health risks from having a retroverted uterus? Uterine incarceration is a rare but serious condition caused by a retroverted uterus. This is a condition during pregnancy where a retroverted uterus doesn't shift to the anteverted position. During the second trimester of pregnancy, your uterus should tilt forward, which allows it to fully expand. If it doesn't change to the anteverted position, your uterus can become trapped within your pelvis. How can I prevent health risks from a retroverted uterus? There's nothing you can do to prevent a retroverted uterus. Most of the time, it is beyond your control because it is caused by a medical condition that can't be prevented. If your retroverted uterus is caused by pelvic inflammatory disease, you can reduce your risk of PID by practicing safe sex. Wearing condoms and limiting your sexual partners can help reduce your risk of sexually transmitted infections, which can lead to PID. If you have a retroverted uterus, contact your healthcare provider if your pain and discomfort become unbearable. Painful sex and painful menstruation are the two most common reasons you might see your healthcare provider for a retroverted uterus. Your healthcare provider will want to rule out any health conditions that are causing your symptoms. Retroverted uterus cause a miscarriage. A retroverted uterus can't cause a miscarriage. If you have a tilted uterus and experience a miscarriage, it's likely caused by another factor like a chromosomal abnormality or an underlying uterine condition. In rare cases, uterine incarceration can cause a miscarriage. A retroverted uterus can be diagnosed during a pelvic exam. It usually doesn't cause any serious health problems, but if you're experiencing discomfort or pain, talk to your healthcare provider about your symptoms. They can recommend a treatment to relieve your pain and rule out a more serious condition.